Hey guys, welcome back to my channel. So we would solve a new case today. So we have a 56-year-old female patient with epigastric abdominal pain and fever of 102 Fahrenheit with multiple episodes of vomiting over past 12 hours. So let's start the case. First of all, we have to check the vitals of the patient. So attach the monitor and also conduct an ECG. So as we can see in the monitor that the patient is in tachycardia with hypotension and also has fever. Even the ECG shows sinus tachycardia without ischemic changes. So we would start with stabilizing the patient. Attach a IV line, maybe two, for better access for taking any blood samples and fluid resuscitation. So first of all, as patient is having severe abdominal pain, we would like to give analgesics like morphine or fentanyl bonus. And also to subside the fever, we can give ibuprofen or PCM. As patient is having vomiting, so we can also give patient ondansetron or metoclopramide. So as we can see, the fever has subsided. So let's start patient on fluids. We can either give normal saline 1 liter or DNS or ingalactate. Now let's conduct basic investigations for this patient. We can first take blood sugar levels. As the patient is experiencing abdominal pain, so we can conduct ultrasound of right upper quadrant. In lab investigation, we can start with basic chemistry, then blood type, calcium levels, CBCs. We can check for lactate for fluid resuscitation if needed. We have to conduct LFTs, and for pancreas we can conduct lipase and amylase test. So from the lab reports, we can see that patient is in septic shock. We can diagnose a patient on septic shock with following criteria like temperature of more than 38 degrees Celsius, that is 100 Fahrenheit, then heart rate of more than 90 beats per minute, and respiratory rate more than 20 per minute, and WBC count of more than 12,000 per mmq. And also the patient is in hypotension. Um, let's conduct basic examinations like check for circulation, airway, breathing, which all are normal. In cardiac examination, we can see patient has tachycardia. Um, in abdominal examination, we can see tenderness to palpation in the epigastric and right upper quadrant without Murphy's sign. For those who do not know what Murphy's sign is, Whenever we try to examine patient and we palpate for the gallbladder while inspiration, the patient stops breathing. If we can see this sign in the patient, then it is Murphy sign positive. Cold and dry skin also shows us that patient is in septic shock, and patient also has jaundice. We can add blood culture in this patient, and for intervention we can start broad spectrum antibiotics for prophylaxis. Before starting, we should ask patient if they have any drug allergies. So in this case, we cannot use any beta-lactam antibiotics. So we can choose ciprofloxacin and metronidazole to cover up gram-negative bacilli. We should also start patient on vasoactive agents like norepinephrine. We should conduct chest X-ray to rule out any pulmonary pathology. So the X-ray seems to be normal. Now we should conduct a USG for right upper quadrant. So the USG for right upper quadrant shows that gallbladder wall is normal, negative Murphy sign, gallstone are present, and common bile duct appears dilated to about 1 centimeter. And to be sure enough, we can also conduct CT abdomen. So from the CT abdomen, we can see that the patient has intrahepatic ductal dilatation with distal biliary obstruction. So now for differential diagnosis, the patient might have cholangitis. We rule out that patient does not have any gallbladder wall involvement, so cholecystitis is unlikely. Other we can have choledocholithiasis. So the referral says that the patient needs ERCP. ERCP basically stands for endoscopic retrograde cholangiopancreatography. For extra edge, this patient shows clinical symptoms of Reynolds pentad, in which it consists of Charcot's triad, which is fever with right upper quadrant pain and jaundice, plus hypotension and altered mental status. So now hand it out to Uh, as the patient needs to undergo ERCP, we would prepare the patient for operating room, and my diagnosis is cholangitis.